Having increased visceral fat, also known as abdominal belly fat, is associated with various health risks. Unlike subcutaneous fat, which is located just below the skin, visceral fat accumulates deep within the abdomen. It surrounds your internal organs like your liver, your pancreas, and the intestines. So what are some of the health risks related to high visceral fat? One is type 2 diabetes. Having high visceral fat leads to insulin resistance. This is where the body becomes less responsive to insulin. Insulin resistance is a precursor to diabetes. Another is heart disease. Increased abdominal fat is linked to increased inflammatory markers, which contribute to the development of hardening of the arteries, which in turn increases the risk of heart disease, heart attacks, and stroke. Another health risk is high blood pressure. Increased fat in your abdomen releases hormones and other substances that interfere with blood vessel functioning, thereby increasing blood pressure. Liver disease is another health risk associated with elevated visceral fat. Fatty acids get released directly into the liver, leading to increased fat accumulation. This causes fatty liver disease, which can progress to more serious conditions like liver fibrosis, cirrhosis, and liver failure. Certain cancers are also linked to high visceral fat. Studies have shown that increased visceral fat is associated with a higher risk of developing certain cancers, including colon cancer, breast cancer, especially in postmenopausal women, and pancreatic cancer. Keep in mind that everyone carries some amount of visceral fat, but having too much of it is what causes health problems. Maintaining a healthy lifestyle, which includes regular physical activity, a balanced diet, and managing stress levels can help reduce visceral fat. If you are concerned about your visceral fat levels or any related health issues, consult us here at Physicians Premier Weight and Wellness Center. You can also reach out to us at healthymeweightloss.com.